proper skin coverage for the entire area by working up higher on the buttocks with the second and third wrap. For proper tension, make sure you grip the contouring wrap and pull it around the individual from hand to hand and side to side. This is very important and will take you a little while to become proficient. It is our experience that when you stay at your client's side and use the mirror, the tension of the contouring wrap will be more uniform than if you try to walk around the client. Remember the groin pressure point and simply lessen the tension when bringing the contouring wrap across the upper thigh. Repeat the 3 diaper wraps on the opposite side. The end results of the diaper wrap is the buttocks are lifted, the back is supported, the hips are smoothed out, and the abdomen is pulled in. Buttocks lift. 2 contouring wraps will be used for the buttocks lift. With your client's back to you, begin by reaching the contouring wrap around to the front with the middle of the contouring wrap at the waist. Bring the loose end and the rolled end around to the back, crisscrossing and making an X on the buttocks. With your client's legs together, continue the contouring wrap around, making a straight line in front. Bring the contouring wrap around and under the buttock and back up to the opposite hip, then around the front to the hip and back down to the opposite buttock, creating an X. Continue until the contouring wrap has been used. The second contouring wrap is applied the same way, except you will wrap in the opposite direction from the first wrap. This is done by changing hands. The end results of the buttocks lift are each cheek is lifted and the lower abdomen is pulled in. Skirt wrap. 1 to 2 contouring wraps will be used with the skirt wrap. With your client's back to you, begin by bringing the contouring wrap around to the front of their body, keeping low on the legs. Bring the loose end all the way around to the back and just under the buttocks, securing the wrap on your client's side. Tightly wrap around the body, slightly working upward with each round, creating a skirt effect. Do not wrap above the buttocks as the lower back is a pressure point. If your client has loose tissue on their outer thighs, add a second skirt wrap by changing hands and changing the direction in which you are wrapping. The end results of the skirt wrap will provide better shaping of the buttocks and saddlebag area. Crisscross to back. 1 to 2 contouring wraps will be used for the crisscross to back wrap. With your client's back to you and beginning above the waist, bring both ends of the contouring wrap around to the back, creating an X on the lower back. Then continue with the rolled end straight around the front and around to the back, coming up and creating another X. The crisscrossing girdle effect adds support and comfort to the body. Continue the X process until you have used the contouring wrap. On larger clients, add a second crisscross to the back by beginning with the opposite hand and changing the direction of the wrap. The end result, the buttocks are smoothed and the stomach is flattened. Crisscross to front. 2 contouring wraps will be used for the crisscross to front. With your client facing you, reach around and start at the back. Place the contouring wrap on the upper back and create a large X on the abdomen. Begin the second contouring wrap the same way, except use the opposite hand to create even tension. The end result? The abdomen is flattened and will be firm to the touch. The crisscross to front is the last wrap applied to the lower body. At this point, look at your client's body to make sure there are no bulges and that the contouring wraps are smooth and their body feels firm to the touch. Bust lift. For the purpose of this training tape, our model is wearing a bra. In most cases, the results will be better if a bra is not worn. 1 to 2 contouring wraps per side will be used for the bust lift. With the client facing you, reach around the client and secure the loose end of the contouring wrap with the rolled end. Using very little tension, lift the bust, or on a man, the chest, moving to the opposite shoulder. From the shoulder, bring the contouring wrap diagonal to the side you started on. Continue the diagonal pattern until the contouring wrap has ended. Note that you are working only on one side at a time. If your client has a large frame, it may be necessary to add a second bandage on the same side. This wrap is designed for the male client and the smaller busted female. Wrap the other bust in the same manner, but begin the wrap in the opposite hand. Use 1 contouring wrap per side on a light build person and 2 per side on a heavy build person. Wrap with little to no tension, being careful of the pressure point under the arm. The end results? Lift the breast and contour the upper body. When wrapping the larger busted female, begin as you would with a regular bust lift, but bring the contouring wrap under and around the outer side of the opposite breast and to the top of the shoulder. Continue with the diagonal pattern on the back and around to the front, working on one side of the chest at a time. Bust smash. Use the bust smash on your larger clients. 1 contouring wrap will be sufficient. With your client facing you, and again wrapping with light tension, secure the contouring wrap on the side and wrap in an upward lifting fashion as you take the contouring wrap around the body. Arms. 1 contouring wrap will be used for each arm. Putting extra solution on the bicep area will help with the tightening process. With your client's side to you, begin with the rolled end of the contouring wrap at the outside of the arm. Begin at the wrist and work upward toward the heart using no tension. Take the full width of the contouring wrap across the inner fold of the arm, as this is a pressure point. Once the entire arm area has been covered and the top of the shoulder, work downwards again. Do not go below the elbow. Secure the contouring wrap. Repeat this procedure on the other arm. The end results? Arms are smooth and firm. Shoulder wrap. 1 contouring wrap per side is used for the shoulder wrap. With your client's back to you, bring the contouring wrap around the client and secure the loose end. With light tension, bring the contouring wrap diagonally across the back to the opposite shoulder. Diagonally take the contouring wrap to the opposite side of the under chest and diagonally back up the back to the opposite shoulder to the starting point. Continue until the contouring wrap is finished. Using light tension, repeat the procedure on the opposite shoulder by beginning with the contouring wrap in the opposite hand. Once the wrap is completed, help your client into a vinyl suit as their mobility is restricted. Since the universal contour wrap is a cool process, the vinyl suit will help to maintain their body temperature for the 60 to 70 minutes your client is in the wraps. Optional neck and chin wrap. The neck and chin wrap should be applied after the vinyl suit is on your client and will require one contouring wrap. The neck and chin wrap can be performed in conjunction with the full wrap or as a partial wrap. With your client facing you, place a plastic cap over their head. Apply universal contour wrap solution under the chin and on the neck. Bring the contouring wrap under the chin and secure the loose end on top of the head. Then bring the rolled end of the contouring wrap down and under the chin and around the neck to the opposite side of the face and back up. Go around the back of the head and over the forehead, continuing this procedure until the contouring wrap is used. The end results: loose skin on the neck and the chin is tighter. Number 4. Exercising. With the wrap completed and your client in the vinyl suit, it is now time to show them a few exercises that they will need to perform while in the wraps. Although your client will achieve results without exercise, the results are better when doing isometric type movements. Your client should not do aerobics or perspire while in the wraps. A common room where your client can perform these exercises is recommended and will keep your treatment room available for additional wraps. Number 5. Wrap removal. After the 60 to 70 minutes, it is now time to remove the contouring wraps. Start by removing the vinyl suit. Remember to assist your client as their mobility is restricted. Remove the contouring wraps beginning at your client's head and working towards the legs. Some clients may want to help with the wrap removal, but this will only slow the process. As you remove the contouring wraps, use the wrap to remove any excess clay that is left on the body. You may want to take a cool, damp washcloth and wipe over the parts of the body that may be exposed after your client puts on their clothing. Number 6. Final measuring and results. Number 1. Proper measurement stance. Number 2. Keep fingers out. Number 3. Keep uniform tape tension. Number 4. Ink marks to find identical points for remeasurement. Please review the specific measuring points that we discussed earlier. Simply remeasure as before using the ink marks as your reference and placing the tape measure just below the ink mark. Again, use the mirror to help keep the tape measure straight. After the remeasuring process, spray your client with the C-Clay Body Mystique. The Body Mystique is the only skin moisturizer that we recommend after using the Universal Contour Wrap. You should also advise your client to continue to use the Body Mystique between and after their wraps. Remove any ink marks with a cotton ball and rubbing alcohol or witch hazel. We recommend that your client does not shower for at least 5 to 6 hours after the Universal Contour Wrap, as the skin is still reacting to the solution. Actually, your client will feel refreshed and clean once their body is dry. Use the time while your client is dressing to calculate the results and tidy up the wrapping area for your next client. Number 7. Final counseling. After your client has finished dressing, review the results of the treatment by discussing their areas of greatest inch loss. Point out how they can benefit through additional wraps. This is the time to ensure that your client returns for further treatments. Explain the different programs of wraps you offer and the program you recommend for your client. You should schedule your client's next visit within 7 to 10 days. Note their inch loss and give your client a copy of the after wrap instructions to ensure they maximize the results of their treatment. They will also want to share the results with their friends, which means more customers for you. There are several optional wraps that will allow you the opportunity to offer additional services to your clients. Spot wrapping. Partial wrapping is a profitable alternative for your clients who only want to target certain problem areas. You will find that many of your clients will pay a little less to receive a wrap only on an isolated area. This may be after a series of wraps or between full-body wraps. Partial wraps can be performed on the arms, bust, hips, buttocks, and lower abdomen, ribs, buttocks, and abdomen, neck, and chin. Your training manual will give you additional information on partial wrapping as well as suggested pricing. Thank you once again for choosing the Universal Contour Wrap. If you have any questions or need assistance with any part of this video, please contact your local representative or Totally You Incorporated.